Hi, I'm Harvey Nix. I'm a physician assistant and regional director of hospital palliative care at Four Seasons. As is the case in most diseases that progressively worsen with time, dementia presents a host of challenges to the caregiver that can last a number of years. Cognitive losses, lack of orientation, functional dependence for things like dressing, bathing, toileting, and eating, and poor safety awareness require constant vigilance on the part of the caregiver. Personality changes and disturbances of behavior like agitation and even aggression to the caregiver, along with disturbances of sleep-wake cycle, can take a toll on the most loving and caring caregiver that one could ask for. Studies have shown that caregivers of dementia patients take fewer vacations, have fewer hobbies, report higher emotional and physical strain, and many times disrupt other close relationships with family members, and even affect their career and job benefits. With this strain on the caregiver, coupled with the vulnerability of dementia patients, dementia is a risk factor for mistreatment of older adults, often unintentional, and detected only after significant issues come to a crisis. Caregivers must recognize early on in the disease, even discuss with the patient at that point, their capacity for caregiving, what they feel they can do safely. They should have a threshold for at what point they would relinquish care to hired caregivers and volunteers in the home or even adult daycare programs, and when they would place the patient in a nursing home or a long-term care facility. Recognition of sleep hygiene, physical well-being, depression, and anxiety should be met with interventions to optimize the health of that caregiver, to avoid burnout, reduce mortality that's associated with emotional and mental strain, and reduce complicated grief and bereavement. A caregiver should consult their primary care physician for continued health and wellness checkups. Local branches of the Alzheimer's associations can be an excellent access point to both educational material and to support groups. You can learn more about those at alz.org. Other community resources that could be helpful include aging resource centers, hospice and home care centers, community transportation resources, adult daycare programs, and other education programs. For more information on community resources, we hope you'll explore our website to find some of the programs that may be able to support you and your loved ones.